So Dr. Kreider is going to speak on the topic of emerging creatine research. Dr. Kreider is a Ph.D., professor and executive director of the Human Clinical Research Facility and director of the Exercise and Sports Nutrition Lab at Department of Health and Kinesiology at Texas A&M. He is a co-founder of the ISSN, the International Society of Sports Nutrition, founding editor-in-chief of the Journal of the ISSN, and fellow of the American College of Sports Medicine, ISSN, American College of Nutrition, and National Academy of Kinesiology. His research generally focuses on the role of exercise and nutrition on health, performance, disease, and rehabilitation. And with that, thank you for joining us, Dr. Kreider, and I'll turn it over to you.
Thank you. I'm trying to get my slides set up.
And we can see your screen.
How did we do that earlier? Display settings. Here we go. Okay, that should work a little bit better. All right, did everybody see that?
We sure can.
Okay, thank you so much for the opportunity to be here and give you an update about the latest about creatine supplementation, not only about performance as we think about in sport, but really the burgeoning area of the role of creatine in health and disease. As you know, the creatine is the most popular nutritional supplement for ergogenic aids for athletes. It increases muscle creatine content concentration, improves performance and exercise and training adaptations. And it can help recovery from injury, exercise, help thermoregulation, promote rehabilitation, and even there's evidence in animals about reducing the severity of concussions and spinal cord injuries. And so there's a number of clinical applications that have been identified with creatine over the last really 30 years. And the reason for this is there's an enormous amount of research that shows that creatine is more than just increasing fuel source in the muscle as we initially thought it was. And here's a diagram from a recent paper that Diego Bonilla and myself and others had done, where we talked about all the metabolic roles that creatine has, not only for increasing energy availability in the phosphagen glycolytic systems to improve high intensity exercise recovery, but really in neuroprotection, ion transport, movement and synthesis of protein, et cetera. And everywhere you see on this diagram a bright green illumination point is where in the cell in the muscle creatine can play a significant role. And this really provides the basis of why creatine is so important for not only health, but also in some disease management. And so to give you a quick reminder, we can produce a bit of creatine in our own. We can synthesize creatine. It's a naturally occurring compound that comes from arginine and glycine and is synthesized by specific enzymes in muscle and liver and kidney to produce creatine that then is stored in the muscle. In individuals with some of these enzyme deficiencies, especially in infants, often have maturation problems and development problems, physical and mental. And so it's really important that the body has enough creatine that it can synthesize, or it depends on dietary sources of creatine to try to provide the available creatine. Most creatine is stored in muscle. About 2/3 is phosphocreatine and 1/3 is free creatine in and around the cell. Vegans and elderly typically have less muscle creatine, as you can see, meat-eating type diet versus a vegetarian or elderly. About half of that creatine need comes from synthesis and about half comes from the diet. And individuals with lower levels or lower dietary availability of creatine are going to be more dependent on synthesis. And the result is we typically don't maintain an optimal amount of creatine in muscle or brain, certainly not optimal levels unless we supplement. So it's recommended that individuals get 2 to 4 grams of creatine in their diet per day. Meat and fish have about 1 to 2 grams of creatine per pound. So really dietary supplementation is the best way to get creatine. If you consume 5 grams of creatine, you get a marked increase in creatine in the blood. In this case, this is creatine monohydrate. And this is similar to in orange, if you have a pound of meat that contains about 2 grams of creatine, you get an increase in creatine. The same as 2 grams of creatine monohydrate in fluid in shells or gels or fluid or even candies cause this kind of increase in creatine in the blood. And that's the first prerequisite for increasing muscle creatine content. Creatine monohydrate is very stable in powder. And as we'll see, when you have small drops in pH, like you mix it into a lot of liquids, after about 8 hours, especially after 3 days, it may degrade into creatinine. However, if you consume creatine right away, because the stomach pH is less than 2.5, it protects creatine. And that's an important concept to understand different types of creatine that are available on the market. Almost 100% of creatine monohydrate that's consumed is bioavailable and will either end up in muscle or tissue or be excreted in the urine. In fact, we did an update to bioavailability of creatine earlier this year. And if you look at all the evidence again, looking at studies that have actually looked at creatine, does it increase blood, does it increase muscle, does it have any exercise benefits? The only one that's strong evidence is creatine monohydrate. There are a few types of creatine out there that are easily degraded to increase blood levels of creatine and can increase muscle creatine to some degree. But generally, they are proportional to the amount of creatine contained in these. These often have less than creatine monohydrate, and none of these have been shown to have any more effect than creatine monohydrate. There's a whole bunch of things that have been purported and advertised, suggested to be good forms of creatine that either have no data, or in the case of things like creatine-L-leucine, actually have data showing it absolutely doesn't work. And so these other forms don't seem to be effective. And so the key point here for the industry is creatine monohydrate is the most effective and is the only GRAS that's available in the US, as well as in qualified health claims even in Europe. So a little diagram we had in this paper, creatine monohydrate is still the top form of creatine out there. A few in yellow have a little bit of benefit, but you tend to typically have to consume more of this to get the same benefit of creatine. And generally, these are more expensive forms of creatine. So what's our typical loading and maintenance doses? We still recommend loading to maximize creatine stores. This promotes about 20 to 40% increase in muscle creatine in 7 days. This is about 15 to 25 grams per day for about 7 days. If you want to have a slow increase in creatine in the muscle, more for health benefits, it's generally about 3 to 5 grams of creatine per day. This causes in 30 days a 15 to 20% increase, about half that you would expect to see with loading, which is why we still recommend loading. And then we'll see for general health about 3 to 5 grams per day. Everybody ought to have creatine in their diet at that level. And then there are therapeutic benefits that have studied up to 5 years where there typically are higher doses like loading doses for long periods of time over years to get those type of benefits. So when you consume creatine in your diet and load, you get about a 20 to 40% increase. And if you consume with carbohydrate, you get a little bit better. We sometimes talk about non-responders. That's kind of a misnomer. Everybody that adds creatine to the diet will increase creatine stored to some degree. Those that start out with higher levels to start will have less of an impact because you typically only get to about 160 millimoles per dry weight muscle. And those who are vegetarians, olders, or we'll hear from Dr. Abbie Smith in women, maybe have more of an increase because they might start with lower levels. We think that's a better term, is less responsive, but not a non-responder. And so this is how we recommend creatine. So if you look at the position standard of ISSN, which you've seen, we actually helped craft this in cooperation with the Council for Responsible Nutrition. It's the most effective ergogenic aid. It's been reported to be safe. There's no compelling evidence. Even doses up to 30 grams per day for 5 years has any detrimental effect in healthy and in therapeutic populations where it's been studied. As long as kids and adolescents know what they're taking, take proper dosages and types, there's no reason there for them not to take creatine. especially if they're serious athletes, training involved, have a good diet, and all those type of things we typically look for. A lot of label advisories are more just legal, protect themselves. There's really no data showing anybody less than 18 doesn't benefit or has any greater risk. It's creatine monohydrate, the most extensive study, clinically effective form. Adding carbohydrate or carbohydrate protein optimizes creatine storage. The quickest way is the load, which is still what we recommend. And in clinical populations, they typically have taken 21 to 56 grams per day for a 70 kg individual for years, some populations for over 10 years without any serious effect. So we then pointed to further research looking at some of the medical benefits, which brings us really to what we'll talk about today. Last year, we started an effort to really focus on the health benefits of creatine in addition to performance. And we started in collaboration with AlzChem to put a scientific advisory board together. One of our efforts was to try to develop the state of the evidence on creatine in health. And the first paper to launch this special issue in Nutrients was something that myself and Jeff Stout wrote on an overview of the health benefits of creatine in all the areas. And this was then published and had talked about all these particular areas where creatine has been studied to see if it has therapeutic benefit. We then launched a huge conference that was held this March. You can actually go online and see all the presentations for free at creatineforhealth.com, as well as all the published papers related to this. And this now has come out in a book. And the reason we're focusing on this is because there are much more benefits to creatine than just sport and training and adaptations to performance. There's really lots of benefits for general health throughout the lifespan. And therefore, it's recommended that all individuals consume creatine at least 3 grams per day throughout the lifespan to optimize the availability of creatine for the body and for metabolism and health. So to give an idea about the general health benefits, Andrew Jagan did a paper on children and adolescents. And the bottom line was that kids can benefit with neuromuscular and metabolic disorders, kids that have myopathies and muscular dystrophies, wasting conditions, cancer conditions, clinical depression, traumatic brain injuries, spinal cord injuries, orthopedic injuries, or rest immobilization. There's even data showing now that kids who have less creatine in their diet, as they grow through adolescence, have less body weight, less muscle mass, and greater body fat, and therefore have less normal adaptations. And so creatine's important impact for general health. And there's no reason not to allow kids to have normal amounts of creatine in their diet. Ben Wax did a great paper on summarizing the ergogenic benefits, and we broke this down into strength and power and prolonged exercise and specific skills and specific sports. And the bottom line is, as we know, creatine is great for lots of different sports. It goes well beyond the effects on just muscle mass and training and power sports, as this paper describes. And then Darren Kandel talked about how creatine can affect aging. And we now have a number of studies showing that if you take creatine throughout the lifespan, you can maintain muscle mass better, you can maintain bone mass better, you're stronger, less risk of falls. And so elderly individuals really should be taking creatine. And it may even be more important for creatine in your diet as you get older than even in the younger individuals. So osteosarcopenia, sarcopenic obesity, frailty, cachexia are all areas where creatine now is a major focus. There's also the effect of creatine on brain health. Eric Rawson and their colleagues did a very nice paper summarizing the literature. And if you take loading doses of creatine, you typically can increase your brain content by about 5 to 15%. And this improves the energy availability of the brain and directly affects things like memory and cognition. It helps you focus better when you're tired and fatigued after sleep deprivation or exercise. There's even evidence in animals that it can reduce the effects of traumatic brain injury, reduce the size of the impact of the injury, aging, Alzheimer's, even depression. And so there's lots of benefits for aging, not only the physical benefits, but even the psychological and cognitive benefits of creatine. This is an area of great research now. Dr. Balstrania also talked about the role of creatine in health, in heart health particularly. And when you're in heart failure or your myocardial creatine content decreases, it's associated with less force of contraction in heart function. So creatine supplementation has actually been shown to be an important energy system, particularly during ischemic heart events like during heart attack or angina, where there's a limitation in oxygen availability because it improves the heart's ability to contract. It also may reduce arrhythmias associated with ischemic events. And so they're actually using creatine loading before heart surgeries to help improve heart function, particularly as they do their heart surgeries and things, and even before surgeries at high risk of stroke. Great paper by Holly Clark and colleagues on vascular health with creatine. Creatine affects the endothelial cells, which affect vasodilation and constriction. There's antioxidant effects, and we believe that this has a direct role on improving the vascular system's responsiveness and managing blood pressure. And a paper that this group just came out with further reiterates this particular point, that there's benefits to the vascular system due to creatine supplementation. And so there's lots of health benefits, and Abbie will talk more about the role in women's health, which is fascinating. But let's talk about how it can affect therapeutic populations. Well, the first population that's been studied is the role of creatine in kids with creatine synthesis deficiencies. If you don't have those enzymes that allow for creatine to be taken up into the muscle or brain, you have significant physical and mental function limitations in growth and maturation. So these kids are given large amounts of creatine. These are like 2.5 times loading levels for a kid. And it improves their clinical outcomes because it allows, particularly with AGAT and GMAT deficiencies, more creatine in the brain so they grow more normally. They're actually doing genetic testing in infants now to see if they have these deficiencies. And the sooner they start creatine supplementation with these particular enzymes deficiencies, the more normal the growth and maturation is. If they delay 2 or 3 years, it actually is more like a mental retardation or development deficiency. Dr. Marshall did a great paper that I was involved in on the role of creatine in mitochondrial dysfunction. There are lots of diseases that affect the mitochondria's ability to function. And creatine plays a particular role in shuttling intermediates in and out of the mitochondria. And so creatine has a role as an antioxidant and neuroprotective, reduce the amount of lactic acid buildup in response to activity, and the calcium homeostasis of moving calcium in and out of the cell for normal muscle contraction and nerve function. So it has a direct impact on mitochondrial survival. So in cases like brain injury or ischemic heart disease, or issues where there's a lack of oxygen capacity for aerobic exercise, the availability of creatine is a backup system to help with mitochondrial survival and has a key role in optimizing health for this reason. Kylie Harmon from UCF with Dr. Stout did a great paper on the role of creatine in rehabilitation. And they were able to look at all the literature and showed that if you're recovering from exercise, a spinal cord injury, have arthritic diseases or muscular dystrophy, it's likely effective. Most studies show effective. It's possibly effective with acute injuries, immobilization, COPD, heart failure, mitochondrial cytopathies, and some different diseases, and less effective in these diseases here. So there's a role of creatine in physical rehabilitation. Then a study that Bruno Galano's group did in a paper on glucose management. Did you know that creatine can help diabetics manage their blood glucose better because of the enhancement of glucose sensitivity with creatine, especially when you combine it with training? So diabetics may benefit from creatine supplementation. There's also some fascinating data from Kristen Drescher's group at Creighton that shows that creatine directly affects the immune response to immune challenges. And this can be considered an adjunct of therapy to help ameliorate or lessen the pro-inflammatory processes that are involved with many diseases and immune dysfunction. And so this seems to have an autoimmune and infectious disease impact in some animal studies as well as some preliminary human studies. And then probably one of the more interesting one and potentially beneficial ones is there's now data from UCLA and Dr. Lily Yang and others that show that creatine supplementation reduces the growth of some tumors, meaning it could have an anti-tumor growth or immunotherapy effect in cancer patients. And it appears that some tumors are deprived of creatine. And when you increase creatine availability, you get more normal metabolic function, and it actually slows down the progression of the tumor. Interesting. So could creatine actually be an anti-cancer effect? We do know that if you give creatine to cancer patients and you put them in a rehabilitation program that optimizes the recovery, here's indication it may want to start that early and may have some anti-tumor growth as well. And then one of the interesting papers is from Theo Walleman and Carolyn Hall's group out of Nebraska, or I think it's Nebraska, excuse me, or Colorado, excuse me. And they showed that creatine affects bowel inflammation and may have a beneficial effect in colitis and Crohn's disease because it may enhance nutrient absorption because of improving energy availability. And therefore, it may reduce symptoms with IBD or inflammatory bowel diseases. Who knew? And so there's also some data from Perry Renshaw's group and Brent Krause's, who's going to be doing a paper for us. And they actually have shown that when creatine is given to depression patients who are given certain medications, it improves the efficacy of those antidepressant medications and reduces things like interest in suicide. And so this is fascinating data in the role of creatine, increasing brain levels of creatine, increasing energy availability, and reducing depression. Fascinating. And last one is there's now evidence that creatine may play a role in chronic fatigue syndrome or post-viral fatigue syndrome. And this may have applications to COVID, because if you improve energy availability, you might be able to help these individuals tolerate activity better, recover, and get back on the normal path. So the question is whether creatine monohydrate supplementation can actually affect people with chronic fatigue or long COVID. I had COVID about 3 weeks ago, so I was experiencing some of this, and boy, I'm on creatine. I'm trying to get back in training. So the summary, there are benefits of creatine well beyond just increasing muscle creatine and PCR levels, and thereby enhancing exercise performance and training on patients. We now are trying to see how we can use creatine in aging, in middle age, in certain disease, and therapeutic applications. And the reason is because creatine is so intimately involved in metabolic activities, and many of these diseases are improved by improving the availability of creatine. So it also may strengthen the immune system, manage chronic fatigue, recovery. And so in the industry, I think we need to transition from not only a sports supplement, but really branch into how this can improve general health as one ages to promote optimization in health and well-being. So with that, I'll go ahead and stop. Thank you.
Thank you, Dr. Kreider. It was a great overview. We will transition now to Dr. Abbie Smith-Ryan. She is a Ph.D., a professor and director of the Applied Physiology Laboratory at the University of North Carolina, Chapel Hill, and her research centers around the topics of exercise and nutrition interventions to modify various aspects of body composition, cardiovascular health, and metabolic function with a unique focus on women's health. So with that, I will turn it to you, Dr. Smith-Ryan.
Thank you. Can you hear me okay?
Sure can. We can see your slides as well.
Awesome. Sometimes the video audio doesn't work. So thanks to Dr. Kreider for that awesome overview. It saves me time and I don't have to go into all the details. So I wanted to give, I mean, most of you know about creatine and we know all the great benefits, but I wanted to give you just some different insights of why it might be particularly helpful for women with a physiological perspective. And before I even start, I'll just ask a rhetorical question since we're on Zoom, but I'm a full-time working mom of 2 little kids, and this idea of mom brain and the idea of COVID multitasking is the perfect scenario where I see creatine really supporting women and health and all other applications outside of performance. And there's data to support that. But just it's a really classic way of women are different than men physiologically. And when we think about the application of creatine, I'll show you here, there are some potentially unique aspects. So let's dive in. Let's see if it'll catch up here. So when we think about some female physiological considerations, metabolically, we're different. Our muscles, when we think about creatine, they respond the same to training. So the literature suggests, but we have less muscle, generally speaking. And there's data to suggest that we have lower creatine levels in the muscle and in the brain as women. And then we also have differences in bone mineral density that can be supported with creatine. And so there are some specific applications. And I think the other really important piece to think about for all of you in the audience thinking about innovation and products that are out there are, you probably know this, but women are the largest consumers of dietary supplements, particularly as we age. And it's this really interesting aspect that a lot of women are afraid of creatine because of some of the side effects. And so I want to show you some of that. The other piece, when we think about metabolism, there's some key aspects that happen and change over the menstrual cycle, as well as with age. So specifically with the menstrual cycle, in the early phases or the follicular low hormone phase, carbohydrate utilization is varied, inflammation and creatine kinase levels are changed. So higher inflammation, higher CK levels, and sleep is also influenced. And so when we think about some aspects of creatine, creatine can help actually with carbohydrate uptake and kind of pulling it into the cell. Creatine, we'll see, is related to, it's not the same thing as creatine kinase, but related to creatine kinase levels. And so if we shift our focus a little bit more to that high hormone phase or the luteal phase, which is the latter half of the month, we have an increase in energy expenditure, increased protein oxidation, which can lead to greater protein turnover, muscle soreness, breakdown. We also see an increase in fluid retention and increased risk of dehydration. And I wanted to set that stage because when we think about potential for creatine, there's a number of things related to insulin sensitivity and glucose uptake and recovery, as well as a positive effect on fluid retention. And so really, I hypothesized, my group hypothesized before we were going into some studies that the luteal phase or high hormone phase would really potentially see greater benefits from creatine. That being said, not all women have a normal menstrual cycle. Many are taking an oral contraception, or many are losing their hormones based on the transition to menopause. But that idea of that shift in hormones can really impact or accelerate the aspect of creatine, which I'll show you here in a second. So I just wanted to lay that other stage out. I just demonstrated here this menstrual cycle, kind of pre-menopause. If we were to have a normal menstrual cycle, creatine may be mostly, well, it's going to be beneficial throughout the entire 30 days of a month, 31 days, but I potentially more in that latter half of the phase. And it's also that phase where women, their hormones are higher, they don't feel as good, they have more water retention. So there's even better or potential to help overall health and quality of life. Then I wanted to say, I'm going to present just a little bit of data on pregnancy, which is really fascinating. So our hormones are higher. There's a lot of growth and development. I'll come back to that. But then really fascinating to me too is all the physiological, hormonal, and even mental changes that happen as women transition into menopause. And so Dr. Kreider briefly talked about the cognitive benefits, which would be even better for women because we see changes in increased depression and anxiety as women transition to menopause, as well as even greater decreases in muscle. So the benefits of creatine to middle-aged women and older women may be even more beneficial than to men and younger women. So this is a quick summary of key points that we talked about in our review for this paper. And I just wanted to, dove into some potential mechanisms, which I'll talk about here in a second. There's some key hydration things. There are performance benefits, which I think are the least exciting, but I'll highlight those. And then the depression and cognition. It's very fascinating, underrated, and can have huge benefits based on these sex differences that we see in the mental aspect. So when we see, particularly for women, potential mechanisms, and I wanted to set this out thinking about if we are talking about new products or education, how can this be helpful for women? Protein kinetics I would put at the very top because we see greater anabolic resistance in women as they age. Thinking about, injury, thinking about injury of a pregnancy or recovery from pregnancy and birth, thinking about age. Some of these other things, the other key piece I'll pull out is glycogen regulation. So if we're seeing differences in glycogen utilization and storage with hormones, creatine can actually enhance that. So it can directly enhance performance, particularly for female athletes. And then calcium, so thinking related to bone density, muscle contraction, overall health and quality of life. For sake of time, I'll keep going. So I wanted to highlight this. So these are related, but really when you ask a woman, one, they usually think, we still have people saying creatine is like steroids, which it's not. And we have this concern of increased weight and water retention, which is actually, the water retention is a good thing, but up until now, we haven't really understood a lot of where that fluid is shifting. So I wanted to represent here just to demonstrate that with hormones, there's an increased risk of dehydration and increased body temperature. And the idea would be, well, if creatine can help pull water into that cell, could it actually help prevent some of the dehydration? And in men, absolutely. So these studies are all in men demonstrating that creatine actually helps prevent dehydration. With these hormonal shifts, when we think about in women, this is a study we just completed that I felt was valuable for this group. All across the board, creatine loading in the follicular versus the luteal phase basically demonstrated in that high hormone luteal phase, creatine can significantly enhance total body water, extracellular and intracellular fluid, essentially helping the fluid stay more into the cell. The next step would be to look at, does creatine prevent dehydration, particularly for women or in some of these high hormone phases? The other piece was that, and this is consistent for the last 15, 20 years, is that men tend to see a greater increase in body mass with creatine loading. Women have not, and we wanted to look at across the menstrual cycle, and there was no significant change in body weight with creatine supplementation. You can see about a 0.5 pound increase with creatine loading in the luteal phase, which, as I just demonstrated, is mostly coming from fluid. So it's actually a good weight gain, 0.5 pound, nothing significant. So I'm going to keep going due to sake of time, but just some really great data that demonstrates that all women, premenopausal, collegiate athletes, sport performance can benefit from creatine as a result of an increase of strength and performance and anaerobic performance specifically. I'm going to go through these. Lots of benefits on strength performance, exercise performance, and then we recently, one of the questions that still, in my opinion, has yet to be answered is how does it influence recovery from exercise? Based on all of the mechanisms, as well as some sex-based differences, recovery might be different between men and women, and could creatine enhance that? One way we have evaluated is looking at some fatigue index aspects, and typically fatigue is higher in that luteal phase. Creatine appears to potentially influence that in a positive way. So reduced fatigue in the phase of the cycle that fatigue is at its highest. So that has some applications for other ages. So sports performance. And then again, as a mom of 2 kids, I think creatine in pregnancy is totally underrated. And I wanted to share a couple of some great papers. So Dr. Stacey Ellery has done the majority of this work, which started in rodent models and is now moved to humans. And when we think about some of the key things that has happened, or what happens, is that creatine plays a huge role in energy metabolism throughout gestation, along, from the start of fertilization down to, basically changing of the endometrium, from human placental development. And really collectively, their work has showed that it has potential benefits. It's not a magic bullet, but has potential benefits to not only improve kind of the repair and regeneration of the mom, but potential help with the infant if there is any sort of brain or hypoxia upon delivery. There tends to be the support from creatine. I'm going to show you this next slide too. So this is another paper, not in the nutrients, but a really good review that during kind of or if a child is born ahead of schedule, so preterm, creatine can support aspects related to their growth and development, particularly at preterm. So, things related to the pH and antioxidants. Most of the research is showing related to kind of vascular function, immune system. So I think the question would be will it help infants that are not preterm, or how about all the other normal healthy pregnancies? And based on my view of the literature, it's really more of a question of why not. When you look at a lot of the benefit, there really is no negative side effects, and it can only be potentially therapeutic, particularly for the infant. The other piece that I don't have a slide to show you is that the rates of postpartum depression dramatically go up, obviously, postpartum. And a lot of it is related to changes in brain chemistry. And so the supportive literature on brain and depression with creatine, it's one of those things, again, why not? There's a potential benefit to prevent postpartum depression in the mom, which is pretty fascinating. And then just wanted to, round out the age spectrum with postmenopausal women. There's some fascinating data from Darren Kendall's group demonstrating that creatine, particularly with resistance training, significantly increases bone mineral density as well as strength. And this is showing kind of, supplementation for a little bit longer duration. So 24 weeks results in the greatest benefit. And this really goes back to some of the anabolic resistance and training volume and recovery. So women, despite their age, but particularly if they're older, will benefit from creatine on bone and muscle, especially if you add in resistance training. And then last but not least, Dr. Kreider briefly talked about youth. And I think it's my take, and here's one quote from several papers, is this idea that kids should be getting their creatine from food. And if they're eating animal-based sources, they'll be getting it from there. But as you have kids that are growing and maybe not able to consume enough, or let's say they did have a brain injury or they're not recovering, a low dose creatine is not a harmful approach if we've hit the other aspects first. The other thing to think about is, maybe not starting with a loading dose, but a daily 5-gram dose supporting a healthy diet might be a good approach with minimal side effects. And I think even right now, most of our youth are stuck in front of, Zooms. There's so many things happening. We see a lot more anxiety, depression aspects coming up. Creatine could be a more natural approach to helping some of those as we combine in exercise and recovery. So with that, just some things to take away that hopefully we'll have a little bit of time to discuss is that the menstrual cycle matters and age matters, oral contraception and pregnancy matters. There's key things in a woman's life that could be supported by creatine, and particularly different aspects in these life stages. And I think that's something that's not talked about, and a lot of women don't understand that. And so education and products developed for women are needed, particularly that education piece. How do you take it? What does it mean? How should I use it? How will it help me? What are the side effects? Those are all things that I believe should be developed and discussed. So thanks to my lab team and you all, and happy to open it up for questions.
Thank you so much. That was also a great overview. And I know that we're running slightly over time. We do have a few questions that I will pose to both of you and let you guys figure out who's best to answer. If you do have questions, feel free and drop them in the chat. I've got a few here. I think we'll start with this one. Is there a best time of day or way to consume creatine, such as on an empty stomach or otherwise?
I'll go ahead and do that one. Most studies show that as long as you get enough creatine throughout the day, especially after you've loaded for a while or taken it for a while, you probably don't matter. However, as a practical application, what we recommend is that if you're doing activity, have it with carbohydrate and protein in your post-workout supplement. That way you're maximizing glycogen resynthesis, protein synthesis, you've got the creatine there, and it maximizes uptake, not only creatine, but also glycogen. And so that's when we recommend it. There are studies that looked at take it before or after, different times a day. And most of the studies show as long as you're already loaded, you've got a decent amount of creatine, it really doesn't matter. But maybe in the loading period could affect. So we always recommend just take it after workout. If it's just for general health, as long as you get 5 grams a day, you'll be fine.
That's great.
I'll just add one more thing too. I know actually I love to take my creatine about this time when I need a nap. It gives you like this a bit of a low grade stimulant effect where you can, the neurons fire a little bit faster.
Interesting. Dr. Kreider, you mentioned loading phase. So can you expand on that a little bit in terms of when taking creatine for just general health, like you talked about? Is a loading dose or loading phase needed? And if so, how is that done?
Yeah, some people would say if you're just going to have for health, just take 3 to 5 grams a day, and then over time it will get there. I still recommend loading. And the reason doing that is that's the fastest and most effective way to increase muscle creatine, especially brain creatine content. And so load for 5 to 7 days and then maintain after that. That way you get the creatine levels quickly up to optimal levels. You're going to start seeing some benefits over time in training and performance, recovery, cognition. So that's why I still say load. Now, there are studies I mentioned. If you take 3 grams per day for a month, you eventually get there, but you lose all that time where you could get some beneficial effects. So I still say load. I think we are learning that you need to increase the muscle level, but we're finding out you probably need those loading doses longer for the brain and cognitive effects. And so I think 5 to 10 grams a day, you do yourself well.
Very good. I'm going to ask a question that was submitted to us from CRN member Mona Rosine. I hope I pronounced your last name correctly. Her question is creatine supplementation recommended in people with a high blood creatinine?
Abbie, you want to do that or do you want me to do that?
Go for it.
Okay. When you do high intensity exercise, your blood levels of creatinine go up because you're breaking down muscle and creatine actually from the activity. People with higher muscle concentrations or muscle amounts will have higher creatinine in the blood naturally. If you take creatine on top of high level training, you might see a slight increase in creatinine from 1.1 milligrams per deciliter to 1.2. We actually did a long-term safety study and found those athletes who were not taking creatine, football players over a 2-year period, who didn't take creatine had higher creatinine levels because they were breaking muscle down more than the people actually taking creatine. So if you had high creatinine, unless you're at the level of 1.5 or above, which suggests maybe some renal issues, it's not going to affect your creatinine levels. And if you're high with those, there's actually studies, even in renal diseased individuals, that they give creatine to reduce homocysteine levels to help with health, reduce cardiovascular disease. So I can tell you, Mark Tarnopolsky, MD, Ph.D., has been using creatine with his renal patients for a long time, for years, because of the homocysteine effect. So it won't increase your creatinine more than maybe a tenth. And it's not going to be additional to other people that are having high levels of training.
Okay, thank you.
Thank you.
Oh, go ahead.
I just said thank you.
Excellent. The next question is a good one, and one that I'm actually interested in as well, being an endurance athlete myself. I think we traditionally have thought of creatine as a nutrient or a supplement, mostly for strength or power applications. Is there benefit to supplementing with creatine for endurance sports or aerobic exercise as well?
I would say absolutely. So when you think about just some of the other mechanisms behind creatine related to even carbohydrate and glucose and insulin sensitivity, along with some of the hydration and kind of fluid retention, that's actually very beneficial to prevent dehydration, which are two things that are actually even more important for endurance athletes versus anaerobic athletes. So, and then not to mention the recovery component that we see a lot with the endurance athletes. I think a lot of times endurance athletes are thinking, oh, I'm going to gain weight, but it's very minimal, and that weight gain is actually very beneficial because it's all fluid. So it's helpful.
Okay.
Yeah, I would add is the best way to increase muscle glycogen levels is to have muscles loaded with creatine before you start your carbohydrate loading. So that's an effective way to optimize performance. And then almost all endurance athletes do high intensity interval sprints during training and during competition. That directly can be benefited also from creatine. So we recommend creatine for both power and endurance athletes.
Okay, great. Maybe a couple of more questions. Let's see. Now that, so you both talked about the expansion of creatine use beyond just sports application. What would you say is the one or two most promising areas for novel creatine research right now?
Go ahead, Abbie.
Well, I'm biased. So, I mean, I think all things related to women, I think pregnancy and perimenopause, it's these women that need help, and creatine works and they just don't know it, and it's cheap and it's low risk. Like, I think about when I make my shake, I want to make sure it's something my kids can have too. And they, like it's this area that women are buying supplements, but they're not being catered to, and they could have such a huge benefit. So that would be I'll plant that seed.
Yeah, I think that's great. I mean, there are even studies now where they're recommending creatine loading before giving birth to increase the creatine levels so you can withstand labor better. I mean, there's so many applications now. And so I think it's going to be, I think creatine will be eventually a required nutrient because of the just low levels and health problems associated with now getting the NHANES data. I think that creatine will be something like folate for women's health, especially during pregnancy. And I think that creatine is going to be a mainstay nutrient added to functional foods and nutrients as you age for that the lifespan. So we've got to change the mentality. It's only for sport, but now it's for overall health throughout the lifespan.
I think that's great. I'd like you to expand on one topic that you just brought up, which is for during pregnancy. So if a female is consuming creatine during pregnancy or once they've given birth, does creatine pass from mother to the infant when they're breastfeeding or nursing?
That's a great question. The way I've always seen it is that it's not a direct pass, but yes, it does impact kind of their creatine metabolism. I don't know if we know how much actually passes from the mom to the child or even through breast milk, but there is some an impact on fetal development and brain. I don't know, Dr. Kreider, do you know the direct answer?
Well, during pregnancy, we know that the baby, the fetus, is drawing creatine from the mom. And therefore, there's an increased dietary need for the mother to supply the infant. So then once the baby's born, it's like a quality protein. You're going to get proteins from breast milk. I think it's probably greater application in infant formulas that's going to come out. But they're going to start adding a little bit of creatine to the infant formula to try to help development. And this is also a wide open area We know that kids with creatine deficiencies, if they get creatine early, they have better maturation and development. We also know that in large-scale studies, kids with lower creatine content in their diet don't mature as quickly, they're not as tall, they don't have as muscle mass, and they're higher body fat. The question is, perfect study, what about taking kids and giving creatine in their diet throughout the development through adolescence and see how much better they might develop and be able to grow and mature properly. So I think there's a lot of these questions need to be studied, but there's no doubt the increase in creatine availability, even to the infant as they're growing the first couple of years, may be extremely important for their normal development.
Well, and I think the practical piece too that people forget is that, like, when you're pregnant, oftentimes you don't want animal products. You don't want to consume animal products. You can't consume protein shakes. You're not eating enough. And that definitely transitions into postpartum. You're feeding an infant. You don't have enough time or hands to eat, which is what, I mean, I think that's where product innovation comes in, and trying to market and give products that women can actually use that provide that, because they can't get it enough through diet. So not only is there a physiological, there's a very big practical outcome that's being missed along in that kind of time frame.
Okay. Speaking of Dr. Kreider, you mentioned kids or Abbie as well. For creatine supplementation, what is a good age or a safe age to start kids with creatine supplementation? You know, beyond just what we're talking about here, which is, you know, through either infant formula or, you know, in that phase of life.
Well, there's the higher dose studies that are long-term are actually done in kids with those creatine synthesis deficiencies, and they've gone very high levels. I think that you want to make sure there's enough creatine in the diet for normal maturation as the child develops, especially the first few years through into adolescence. The time you really want to focus on creatine loading for performance and actually helping the training adaptation, probably once you have go through puberty, I would say. And so we generally say get enough creatine diet until puberty, and then if you really are interested in building muscle mass and getting larger and stronger, and you're really involved in sports and doing a good diet and doing a good training, understand what they're taking, then you might think about creatine once you hit puberty.
Great. Okay. Well, I think we're sufficiently over time. Thanks to those who have stayed on. I know we've lost a few. But again, thanks to you, Dr. Kreider and Dr. Smith-Ryan. I think this was an awesome meeting, a really great overview and information shared. So if there's follow-up questions that you think of following, please feel free and send those along to Luke or myself. And with that, thank you everybody for joining.